Last week, we introduced you to our new multi-layered project called Kind is Better. We talked to a lot of people, kids, adults, specialists, and survivors. One young woman stuck out to us, a high school senior I talked to on the set, who said adults aren't doing enough to help kids with their mental health.
Because adults, especially parents, have such a big weight put upon them and put so much stress on themselves for their children to do well and to flourish. And so sometimes I think it's easier for parents to brush some of those issues aside.
So here's our question. What can we do? We've heard repeatedly conversation is key. And as K2's Genevieve Rayom reports, that can start with treating mental health like physical health.
Last 10, you got this, y'all.
We focus on our fitness,
super simple.
eat our veggies, and take our vitamins, fueling our bodies to help us live longer. But our muscles won't matter if our mind fails first.
Mental health issues will kind of creep up a little bit, and it's harder to tell when it's time to seek help.
The reality is people are getting help far too late. According to the National Institute on Mental Illness, on average, 8 to 10 years pass before someone struggling with mental health gets help.
Kids don't always understand what they're going through.
Dr. Pat Blumenthal is the director of behavioral health at the Portland Clinic, where within the last 5 years, new doctors and those decades into their practice started learning how to focus on the body and the mind. Patients now fill out these forms when they arrive.
Squeeze all the way up.
So before the blood pressure test,
Measure their weight, and then we step right over here to get their height.
And the measurements, they can assess how they're really feeling.
People are often more comfortable writing down their responses than talking about them.
Dr. Blumenthal says these forms are more common in doctors' offices now as concerns around mental wellness grow. The patient's answers are often an entryway into those tough conversations.
Just talking about it makes a huge difference for a lot of people, right?
Mm-hmm. Absolutely.
Those conversations are essential. Talk about your mind like you talk about your body. Because mental strength is just as important. Genevieve Rayom, K2 News.
Mental health experts say it's important to be intentional about ending the stigma around mental health, same way anti-smoking campaigns have worked to reduce the number of kids who light up.
If mental health was prioritized the same as physical health, that there'd be less stigma. When youth and families are sick, they have no problem accessing physical health services. But for mental health services, they're less likely to do so because of stigma.
Stephen Dunleavy is a mental health program manager for Multnomah County, and he says if we treated mental health the same way we treat physical health and get kids mental health checkups, we'd be more likely to spot issues sooner and prevent things like suicide, alcoholism, and drug abuse. As a parent, you probably have first aid kits stashed all around the house, full of Band-Aids, gauze, ointments. But experts tell us it's just as important to have a mental health first aid kit handy. And that can be as easy as programming these numbers into your phone or your kids' phones. The National Lifeline is 1-800-273-TALK. Youthline is local. It offers peer-to-peer help. Their number is 877-968-8491. You can also text teen to teen to 839-863. Next week, we dive even deeper to find out how your child's next wellness visit at their pediatrician's office might be more than a physical checkup. That's coming up next Thursday on K2 News at 6.